At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. This is yours truly, and we got a beautiful day. Finally, it's gorgeous outside. I flew back in from a meeting down in South Carolina last night, and boy, that wind was bumping all over the place. I'd have to give my hands applaud to the pilot that flew the United Airlines jet coming in. He did an amazing job. He just... winds gusting to 30, 35 miles an hour, and it hit straight on, but he did a great job. Anyway, let's get into the program. I'm here, I'm safe, and hopefully all of you are going to get warmer than it is right now. It's kind of brisk out there. Listen, what we're talking about is pain that goes down your leg, and you want to know whether it's sciatica or whether it's neuropathy, and there's a difference between the two of them. And coming up on the 18th, in a very short period of time, a week from this coming Wednesday evening, the professor and I, Dr. Harlan Browning, will be talking about back pain and leg pain and the differentiations of different types of conditions, but more importantly, what you can do about it. So join us. All you got to do is, you can call the office the old-fashioned way, 703-698-7117, or go to drtomroselle.com, or go to rosellecare.com and check it out. By the way, I want to remind you that we set up a new site for you. Those of you who listen to the program and that want to get certain nutritional products and so forth, you can go to our Ageless Health store, either on Roselle Care or on drtomroselle.com, and go into it, and you can find virtually most everything. The only thing you can't find there is hormones, because you need the prescription. That's my writing a note, and I can't do that unless you're a patient of ours. But having said that, let's get into the program, and I just want you to remember that it's there. We're trying to be much more proactive for you on a lot of different levels. So let's start with what neuropathy is and what it involves. But neuropathy comes from the word nerve. Apathy comes from pathology. And so you have pathology or deterioration or breakdown in the long nerves, but they can be anywhere from the upper body to the lower body. But we're talking about leg pain right now. But neuropathy, if you will, involves damaged nerves that are being broken down. But sciatica, that nerve that goes down your leg, and by the way, it's the back of your leg. It's not the front of your leg. And that's where a lot of misdiagnoses come from. When you're talking about leg pain, if it's a true sciatica nerve pain, it's from the lower back, your butt, down the back of your legs, down your calf, maybe a little bit to the outside of your leg and into your foot and your toes. It does not go down the front of your leg, and it does not go in the inside of your leg. Those are different nerve roots. So if we're talking about a sciatica, it has to be diagnosed properly. And there's really 5 nerves, 5 that make up the sciatic bundle. Sciatic nerve is not one. It's a group of nerves. So we have to be able to put that together and really understand it. So let's review. Neuropathy refers to a damaged or dysfunction of the peripheral, the long nerves, and it can occur anywhere in the body, but it happens in legs, like diabetic neuropathy and things like that. You can end up losing your foot and your toes and so forth if it is a diabetic neuropathy. But we'll talk about that on the 18th as well. Numbness and tingling is a common sensation in neuropathic pain. Burning pain. It feels like it's on fire. Sensitivity to touch. So you have very light touch to the distribution of the nerve, even from socks or shoes. And it could be, oh my God, this is terrible, I can't handle it. But remember, neuropathic pain comes from things like diabetes, infections, autoimmune conditions, even toxins. And when we're talking about toxins, what we're talking about? We're talking about vaccines. We're talking about even heavy metals like mercury and arsenic and beryllium and aluminum, the adjuvants that are in so many different things. That's what we're talking about. And it causes the nerve to break down. There's a sheath around it. It's called a myelin sheath, and that begins to degenerate and deteriorate to the point where it doesn't work, and it affects blood supply, it affects tissue response, and to the point where if you don't take care of it the right way, you can be in big trouble and start losing pieces of you as we go through. Let's get into sciatica, because everybody complains about sciatic pain. Oh, I got a sciatica. Old grandma says, I got a sciatica. Well, it's because her doc told her that she had a sciatica, but it might not be a sciatic nerve problem. Sciatica is a condition all by itself that really is a descriptive of a symptom. It's not a pathology. It's not a disease. Remember I said it goes down from the back, down to the butt, down to the back of the leg, and into the toes and so forth. And it's most often related to a nerve that's pinched in the low back or an entrapment of the nerve as it exits through your butt. That's called your sciatic notch. And that's where the nerve bundle comes out. It's about the size of your thumb. But there's 5 nerves, remember? They come together. And then depending on which one or where in the spine, in the lower back, or in the pelvis is being irritated determines the type of pain that you're going to have. So it can be radiating, sharp shooting, burning, tingling, and it goes down one leg. Sometimes it goes down both. That's usually due to a centralized disc. Can be for other things. We know that stenosis, narrowing of the canal where the nerve comes up, can in fact cause that. And there's something called a piriformis syndrome. What's a piriformis? Piriformis is a muscle that comes across your buttocks and inserts in your hip. And actually what it does, it allows movement and rotation and balances another muscle called the gluteus medius. That means your big butt muscle. That's the middle muscle in between it. So you got the big butt muscle, you got a little one in between, gluteus medius, and you got a really smaller one called the gluteus minimus. And so there's a set of 3, and they all do something that is very different. But never having said that, we have to distinguish if we're going to treat it. To be able to treat these things effectively, and they can all be treated effectively, you have to know specifically what it is and what the problem is. So if you have a flare-up that's the symptoms can worsen with certain movements, such as sitting down or bending forward, often is a sciatica that is coming from a disc that's bulging or protruded. We use the term slip disc, or a crushing of the nerve where the nerve comes out, that's spinal stenosis, or injuries that affect the nerve directly. So we need to get into, we're going to talk a little bit about this, but we need to get into the differences, if you will. So the nature of the conditions, neuropathy versus sciatica. So neuropathic pain is a broader term for nerve damage, while sciatica specifically refers to symptoms arising from the sciatic nerve and its compression, its pressure, its pinching of whatever is causing it, right? All right, so we said the sciatic nerve is 5 nerves, not just one. It's just a term that means we got this bundle of nerves that comes out of your butt, down your leg, into your calf, and into your foot. Now, neuropathy is the covering, the myelin sheath that surrounds these big, long peripheral nerves, and there's degeneration. Now, could you have a sciatic bundle that has neuropathic applications? You could, but one or the other has to be distinguished in what it is. The location of the pain, we said, can affect multiple distributions and branches. And again, neuropathic pain could be multiple areas. Sciatic nerve problem can usually be that way too, down both legs, different branches associated with it, but it can be just one-sided, and that's usually the distinguishing feature. So let me give you a differential while you're listening to me, and knowing what it is, and so you're not freaking out, and you know that it's not a neuropathic problem. So if you're sitting in a chair, we're going to do a slump test, right? So what you're going to do is you're going to drop your shoulders forward, you're going to drop your head down, and then the leg that bothers you, straighten it out. If doing that test, you have more pain, all of a sudden sharp shooting pain, lancinating pain that goes down that leg, that tells you that that leg pain is probably a sciatic pain, but it's due from a disc that is either bulging, slipped, if you will. And it's when you do that, you're increasing the pressure on the disc. So let's talk about that again. What are you going to do? You're going to sit there in the chair. You're going to drop your shoulders forward. You're going to drop your head down, and you're going to straighten your leg out. If that pain jumps at you and bites you really hard, that's an indicator that you have a disc involvement in that area. Now, you can do something else. You can sit there and have your significant other grab your head, put both hands on one side of the head or the other, and lift your head towards the ceiling with about, 10, 15 pounds of pressure. And if you feel pain shooting down your leg, or the pain gets worse, or you feel a little burning sensation, that's often an indicator that you have a spinal stenosis that's causing that leg pain when you're moving around. Now, here, I'll give you another one that's really, really quick to do. Stand up, and, the pain's not terrible. Now, I want you to bend from your waist. Bend from your waist and go just, 5 degrees, 10 degrees, but stop as soon as you feel the pain in your leg. As soon as you feel that sharp pain in your buttock area or in your calf or numbness in your toes, stop. Now, have your significant other come around behind you and put their hands, not their hands, but their arms around your pelvis and hold your pelvis tight. So you're taking all the motion out of the pelvis and then bend forward again. Here's what happens. If you bend forward with that support around your pelvis and the pain gets worse, it tells you that the problem is coming from your low back. If the pain gets better and you can bend further, that tells you that the pain is coming from your pelvis, because what you're doing is you're taking all the motion out of your pelvic structure. So knowing those things can tell you very specifically what to do. Here's the deal. If your doctors aren't doing that, they can't distinguish whether it's coming from your low back or if it's coming from your pelvis. So knowing where it's coming from is one step up in being able to resolve the problem. If you're on the bathroom, if you're on the porcelain throne, if you will, and you're having to bear down too hard to have a bowel movement, and you have sharp shooting pain, or you have groin pain, guys, you have scrotal pain, that tells you that there's some compression, there's irritation in the lower disc levels. Ladies, same thing. If you have pain that shoots vaginally or you shoot into your legs at that point, same thing. You have a problem with the lower spine. So there's a lot of differentiating pieces that, if it's done properly, you can really point at where it's coming from. And to treat anything the right way, you have to be able to finger point to it. You have to be able to say it's coming from right here, right? So when a patient comes in, history, when did it start? What happened? Is it a slow progressive? We have to know whether you're diabetic. We have to know whether you have autoimmune conditions. We have to know whether there's been an infection of any kind. And in today's world, what kind of infections? We're talking about viral patterns, and there's ways of making that determination very, very rapidly. So you have to treat both. It doesn't mean that that area is not involved. It just means that the triggering mechanism initially may have come from someplace else. So you have to evaluate leg pain, and it has to be, is it neuropathic pain? So degeneration, pathological, something of that long nerve that goes in your leg. It could be both sides. It could be one side, often both sides. Or is it sciatica? Often, more so than not, it's just one side. But you have to find out where it's coming from to be able to treat it effectively. So I want to invite you. I want you to join me, though, if you're in the Washington metropolitan area, on the 18th, join us. All you have to do to come to the program is get on the phone, call 703-698-7117 and reserve your spot. And all we ask you for is this. If you know you can't make it, call us the day before. Say, hey, can't make it, and we'll have somebody else take your seat. Do that, or go online, go to rosellecare.com. And by the way, I want to remind you that if you go to our website and you look at the top of the website, there's a block that says, real big letters, it says, for a 20-minute courtesy that's free consultation with one of my amazing doctors who know this stuff inside out and backwards. If you have some questions, they'll be happy to get on the phone with you. And you can ask them, hey, listen, is this normal? Can you treat me? Does it work? Ask them all kinds of questions. But we'll do that on the 18th as well. Listen, let's get into a little bit more. What can you do to help yourself? Let's say that you have all this crazy that's going on. What can you do to help yourself? So if it's a neuropathic problem, I would first have a long conversation with yourself and say, what happens if it is my blood sugar? What happens if it is an autoimmune situation that I've been ignoring and I've been taking all these pills and letting the pills do the job and it's not working the way it's supposed to? What can I do to make a difference? Well, let's talk about those things that go through, that orbicularis oris. What am I talking about? It's called your mouth, all the garbage food that you put in. Did you know that was called orbicularis oris? Like wide, right? In between your lips. Never mind. We won't get to that. But you have to start avoiding things like sugars and sodas and coffees that the amount that a lot of you people are drinking, sugar, sodas, coffee, black teas, fast foods, fried foods, alcohol, gluten, additives, preservatives, GMO products, all the silly, right? All the things that you want, all your comfort stuff. We know that they're loaded with all kinds of things. How about those of you who've had huge amounts of vaccines in your body? Every scare that comes out there, you're putting something in it. And you wonder why you're suddenly starting to develop this numbness and tingling. It just doesn't go away. And nobody told you that the adjuvants, the aluminum and the mercury and all the other pieces that are in there cause all kinds of problems. There's many different exposures, and we have to be aware of what they are. If you're going to clean things up and make things better, you have to be part of the solution. If you're not part of the solution, you're part of the problem. Something was said to me quite a few years ago by somebody that was a very successful. He wasn't in the healthcare arena. He was in the business world, and he used to have ongoing conversations with his top people that weren't producing at the levels that they should. And invariably, part of the conversation would always lead to, you're the cause, you're the solution. You're the cause, you're the solution. So if that's true, what are you willing to do to make a difference? Everybody's got a story. Everybody, well, I got this, I got that. Half of you are sitting, on the sofa with a remote control eating ho-hos, or you're on your cell phones, or you're on computer and you're wasting time. Those are in the younger generation. Do you know that they did a survey of young people between 18 and 35, 37 years of age? And this is the kind of world that we're living in right now that's going to breed its own debilitation over a period of time. These people said on the survey that if somebody would feed them and make sure they had a roof over their head, they would be content and spending their entire day on their computers, on games, on search, on all that nonsense. Can you believe that? 27% of these people would want to do that. No wonder we have a problem. And, we eat from the center of the grocery store, not on the peripheral end of it. The center of the grocery store is what? All the boxed nonsense. Do you know that all that stuff is not allowed in Europe because it looks like a chemistry set, but it's affecting your neurological system? Listen, the 18th of this month, coming up in, about a week and a half, we're going to have a very in-depth conversation on back and leg pain. How many of you are just taking drugs to kind of keep it down? How many of you are, at that place where you've had enough is enough already and you've got to make some changes? And if you don't make some changes soon, you're going to have very, very major, major issues. I don't know about you, but I don't want to live that way. Do you? Do you really want to live that way? Well, we're going to show you how not to live that way. Listen, there's an anti-inflammatory that, and everybody said anti-inflammatory. Am I going to tell you a drug? You know better than that. I'm not going to tell you a drug. No, there's no way I'm going to tell you a drug. Anti-inflammatories are proteolytic enzymes. Proteolytic enzymes. And there's two companies. One is Biotics, and there's a product called Intenzyme Forte. So if you got a burning sciatica, try this because it's not going to hurt you. Take about 4 to 5 of them 3 times a day on an empty stomach. Proteolytic enzymes are things like amylase and bromelain and papain and things like that. And they decrease the inflammation, the inflammatory response, and may give you some relief. It's not going to hurt you. That's the one thing that I can tell you. So where do you find this stuff? And there's another one from Zerex, Zerex company, and it's called Pancreatin 8X. Either one of those will do well for you. So if you go on our website, go to rosellecare.com, rosellecare.com, and you go up to the Ageless Health store, and you click on that, and what you're going to see is you're going to see a site that we developed especially for you. But Ageless Health store, it's really, it was fun putting this together. And if you go through it into Ageless Health store, I'm trying to find the piece for you. It'll say full script. And you go in there and you touch. And by the way, there's 4 products on there that we recommend that you use to keep your health together through all this nonsense. And my staff takes it. I take these every day, all 4 of them, just one of each one of them. I think you'll be surprised how amazing, you'll feel doing this. And that air tamer that's in there as well, that kills about 97% of all, if you will, viral patterns within about 20 minutes. Isn't that cool? Check it out. But anyway, go to full script. You'll find the things that we were just talking about, and then put down the 18th. At the top of the screen, you're going to see 20-minute courtesy consultation. Take advantage of it. Call one of my docs up and have them talk to you. They're great at it and so forth. We're coming up to the end of the program. I want you to understand that I'm here for you on an ongoing basis. One reason only, simply this. I love you all. You have a good day. We'll see you soon. Enjoy the weather.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.